Good evening, ladies and gentlemen. Hello, dear friends. My name is Vasily Rokhovi. I am the hand transplant patient from Innsbruck, Austria, and the founder of the Voice of VCA Patients. Welcome to the interview. Today, our guest is Professor Subramania Iyer, Chairman of the Center for Plastic and Reconstructive Surgery, Head and Neck Surgery, Oncology at Amrita Institute of Medical Science in the city of Kochi, India. Professor Iyer is the president-elect of ISVCA, the International Society for Vascular Composite Allotransplantation. Under his leadership, the India's first hand transplant was successfully performed in January 2015. Good evening, Professor Iyer. Nice to meet you.
Good evening. Good evening. It's great to meet you. Yeah.
Thank you. Professor, first of all, I would like to thank you for your time. I know you are a very busy person and your support of the patient initiative raise awareness about VCA.
Hi.
Professor I, they
Yeah.
say the plastic surgery originated in ancient India. Therefore, it is quite natural that India belongs to the leading countries in the field of reconstructive surgery worldwide, and the Kochi hand transplant program is one of the biggest in the world. Could you tell our viewers, please, about the Kochi hand transplant program? Where did it all start and where is it now?
Yeah. When we started, that was in 2015.
Mhm,
Before in fact, we started the preparation before that. That was maybe you could say that it is 2 years before the start of the program. We
mhm,
thought that it was a patient-driven type of program. When we had several patients who had come and asked for, is it possible to have hand transplants whenever they had, the lot of injuries occur in India, like blast injuries, and then you, you have electrical accidents, like live wires being, carelessly sort of put, and then so people catch it, and then they have severe electric shocks, and those type of patients, we had chances of amputating both
mhm,
limbs, especially in young patients. And then there was always a query from them, what will happen to us, what was thing. And then that is the time. Our unit is a big plastic surgery, reconstructive surgery unit, where we specialize in head and neck, hand, and
mhm,
everything. And so we were considered to be, by that time, one of the leading centers for microsurgery. So everything was there. That is what prompted us to think, are we
mhm,
capable of doing it? Should we do it? Then we
mhm,
all sat together, went through the literature, and found that hand transplants are a good option, especially when the patients have lost both their hands in a
mhm,
way. So that was the reason we started it. In fact, 2 3 patients prompted us. You know,
mhm,
we felt very sorry seeing them because we had to amputate their hands, and then so we that is what drove us into the program.
mhm,
Once we thought about it, we prepared. We didn't have formal training, but we are all well trained plastic surgeons. So you don't need
mhm,
you need to sort of build up the team, and then look at the team, how hand transplant works, and all those things was available in the literature. And then we started working together and got the team together. That's how
mhm,
the team was born. And our greatest challenge was that in India it was never done. So,
mhm,
and first of all, there was a thought block, whether are we capable? Can we execute such a mammoth sort of surgical procedure? Can we organize it? Secondly, the it is a hands are taken from a brain dead person, of,
mhm,
then cadaver organ donation was not
Mm-hmm.
really had not caught up in India that much as in the West. So
Mm-hmm.
we thought that it would be difficult to get the hands donated, which was true. Our main fear was that, which was correct, because we had to wait for a long time for a family to agree for hand donation. And then the legislative issues, because hand was not ever done in the country, and not even the licensing authority, which is the, see, Indian health system is something like, India has got several states, several
Mm-hmm.
provinces, and
Mm-hmm.
each has got authority on the health. Health is the state subject rather than a central subject. So
Mm-hmm.
any of these things has to go through this state government health authorities. So, and I mean, if you want to get a transplant unit certified to capable of doing that, it has to be the state unit. And there we had a great problem, because none of the people in authorities, including the doctors knew that this
Mm-hmm.
could be done. So we had to convince them this is the way it is done, and this is how we are capable of all those things. So finally we got the license, and then we had to wait for about a year. After getting two patients, we had to wait for a year to get the suitable hands.
Mm-hmm.
And finally, on it was on 13th January 2015, this happened. We got the hand transplanted in Manu.
Mm-hmm.
Manu was the first person to receive the hand, and the donation came from Binoy, who was brought in an accident to our
Mm-hmm.
hospital and was declared brain dead. And even though I had personally counseled at least six families before that for hand donation, none of them agreed, because it's a mutilating donation. Naturally,
Mm-hmm.
the people don't agree for that, and nobody
Mm-hmm.
knows that. You cannot tell at that time. So, but Binoy's family was quite gracious enough, saying that, if it is going to be useful to a person, let them take it. So that's
Mm-hmm.
how it started. And since then, after that, the journey has been not really smooth, and this thing, but
Mm-hmm.
slowly we built up the program. We did the distal hand first, then we did the forearm, then the upper arm, and then
Mm-hmm.
even the shoulder level. So the complexity wise also we could scale up, as well as the numbers. Numbers just happened slowly. We were not in a rush to do, but it's a tiring thing is to get the
Mm-hmm.
team organized for a procedure, and then the post-operative care is also quite enormous, and then the surveillance. So we we did it slowly, but still sheer number and I mean, the number of cases that come to
Mm-hmm.
us and that we could do because of the team made us currently what is happening. We have done 22, 23 patients now, 20, 23, I think. So we're making us the largest in the center in the whole world now. It was a journey of how many
Mm-hmm.
years? How many years? 11 and a half years now.
Mm-hmm.
Yeah.
Yeah, thank you. Professor R, according to various sources, as you said, 23 hands have been already
Oh,
uh,
let me. Yeah, yeah,
transplanted in your clinic. Among them were unilateral and bilateral hand transplantations for
yeah,
women and men. Uh,
yeah.
could you tell, please, what main hand functions does the surgery aim to restore?
When we start the hand transplant, we aim to restore most of the functions of that particular hand. That
Mm-hmm.
is, see, when you look at the motor functions are the most important.
Mm-hmm.
Along with that, recovery of sensations. So,
Yeah.
providing a sensate and functioning hand is our aim. But when we do meticulously also, we know that we might not be able to achieve that in all the patients in a way because of the level of the transplant. Secondly, the nature of the injury which caused the
Mm-hmm.
the loss of the limb. For example, if it is a cracker injury, the pathology of the hand is different. If it is a electrical injury, the structures behave not in the similar fashion like a clean cut. So
Mm-hmm.
there the muscles can be bad, the nerves can be bad, so the vessels can be bad. So even though we would have aimed to get a reasonable good function, it might not work because of the nerves don't grow very well in that
Yeah.
particular hand. Generally speaking, distal hands, we would like to achieve at least 90 to 95% of the hand function. So
Mm-hmm.
if it is a forearm, proximal forearm, we will tone down because the intrinsic muscles might not work really well in that. So probably we would say 80 to 85% of function will be quite acceptable for hands above that forearm level, forearm
Mm-hmm.
and above.
Mm-hmm. Professor, I'd like to ask you to focus on one particular surgery. I mean your female hand transplant patient,
Yeah,
Shreya. Her
yeah,
transplant story spread around the world a few years
correct.
ago.
Yeah.
Yeah. Could you explain to our viewers, please, why she received two donor hands from a male donor? What prompted the decision? Was it made because of the female donor shortage, or why?
Actually, see, when you look at it, as I told you,
Mm-hmm.
greatest problem for
Yep.
our transplant unit and the transplant units in the country now is one is availability of the hands, right?
Mm-hmm.
Availability of the hands, and then it should be, it should be matched and all those things, group match. Then transportation of the hand is also a problem because India is a vast country. We don't have a really robust system of transporting the organs
Mm-hmm.
across by air. We know we have been doing it, but it's not that robust. So the availability of the hands for a person who is waiting for hands might not be that brilliant. So
Mm-hmm.
when they wait for some time and then this thing, and finally, we have asked several people. This is like if there is a hand, female hand for a male person or male
Mm-hmm.
hand for a female person, we tell the patient at that time that, see, look, there
Mm-hmm.
is a hand available like this. Otherwise, you are group match and we will be able to get it. You are size
Mm-hmm.
matched and all those things. So you might be able to. Do you want us to proceed? It's only one single instance when that was a male person, male
Mm-hmm.
recipient, who said that no, 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 we don't want a female hand that way. Otherwise, none of them, we have done cross gender transplants like that. So none of them say no because we are also, see, we would like to do it provided they agree because we know that if we say no to this, they might have to wait for much, much, much more longer, indefinite time to get another pair of hands, which they
Mm-hmm.
understand. They don't want to take a chance. And so for Shreya, it just happened that when she, in fact, was quite fortunate in a way, I would say lucky, whatever is that, because
Mm-hmm.
most of our hand transplant patients have to wait at least a year, 2 years, 3 years for a hand.
Mm-hmm.
In her case, it was something like a miracle, like something like happened that she was registered, and the next day we had a call from this hospital saying that nearby hospital saying that there is a hand available. It's a young boy who went into who is declared brain dead. So we called them back, and then we called Shreya's family and Shreya back, saying that, look, there is something like this. Would you like to consider? The Shreya had no doubt about it. She
Mm-hmm.
said, "You just go ahead. That's all." So that's how it went.
Mm-hmm.
And we went ahead that way.
Mhm. That was her decision to accept
Yeah,
the donors
correct.
from. Yeah, okay.
Yeah.
Professor, her transplantation is also remarkable in that the skin color of the transplanted hands adapted to the natural skin of the hands of the recipients. And I would like to ask you, do the skin colors of the transplanted hands and the hands of recipients always match after the surgery, or was it an exception to the rule?
And this has been fascinating because it was not in Shreya's hand. First, we noted in Abdullah's or second hand transplant
Mm-hmm,
patient. He was from Afghanistan, an Afghan soldier who
mm-hmm,
came and then who had lost both his hands in a mine blast and he came over. So he got the hands from Joseph, who was a native of Kerala. And
mm-hmm,
then, as you know, Abdul was very fair skinned and Joseph was dark, dark
mm-hmm,
skinned. So, what we saw with some time was that there was some change in the color of the hand that was given to Abdul.
mm-hmm,
Joseph's hand was losing that darkness to some extent. So
mm-hmm,
that was our first experience. The second one was most remarkable one was
mm-hmm,
Shreya's, where again there was Shreya was really fair skinned girl, and
mm-hmm,
then boy was a bit more dark, and I mean
mm-hmm,
I would say brownish skin. So but then over a period of time, she
mm-hmm,
in fact was documenting it with photos herself in a way. And
mm-hmm,
then she sent, I think I can share with you the photos which she sent, the three sets of photos, which shows that there is definitely a change in the color and it becomes much more uh, I would say not exactly like the recipient's color, but it gets into that level. It's basically more not like not getting dark, fairer
mm-hmm,
in a way.
mm-hmm. Yes, very interesting. If we have already begun to talk about the skin of the transplanted hands, may I ask you the next questions, please? What happens to the hair on the transplanted hands after the surgery? Does it disappear or continue growing as before? And does the hair color of the transplanted hands match with the hair color of the recipient hands?
Yeah, we in fact when we had this saw the change in color of the skin of Abdul, we wanted to do bit of our theory was that it is partly due to the melanocyte stimulating hormone that is produced in all of us, which controls our skin color. So we in fact we had made because we are also new to hand transplant this thing
Mhm,
but we had established contacts with several teams across the world. People had been talking to us, and then we had because this was a unique sort of observation. Nobody had observed this before, so we wanted to do a bit of research, and then we went ahead doing. Our theory was that the MSH of the melanocyte stimulating hormone of the recipient
mhm,
will have an effect on the melanocytes of the pigmented cells of the donor hand. But unfortunately, we couldn't proceed too much in the basic sciences field because, as you know, evaluation of this area is not well studied or amenable to the research in that fashion. We had talked to
mhm,
several people. We tried to do it, but it never happened. But my at that time, my thought process was that it is due to the hormonal influences. And
mhm,
in case of Shreya, there was another thing that see it could be something related to that also her hormonal influence. And along with that, she had some rejections in between, more rejections, and with a culminating in a PTLD, which we could rescue her from that without much problem. So there
Mm-hmm.
we started applying tacrolimus ointment and the clobetasol, that's the steroid ointment,
Mm-hmm.
regularly on the skin. And then she was supposed to keep it wrapped up because we want to reduce the systemic immunosuppression.
Mm-hmm.
And then I thought that, okay, this also would have partly contributed. Like the steroid has got a slight tendency to decrease the pigmentation. But that is, again, there is no scientific proof to that. It
Mm-hmm.
might have helped. That is why it was much more striking in Shreya than in Abdul. So
Mm-hmm.
these things together. But definitely, I can say that in most of the patients, the color changes and color fades. Dark, especially the if the donor is a darker sort of hand and the recipient is fairer, it eventually the dark hand becomes slightly more fairer with time.
Patients now. And of course, it would be important to know does the hand transplantation and better to say the following immunosuppression therapy reduce the chances of getting pregnant. Maybe does it have also a negative effect on newborn or not? From your experience, could you share your experience on this matter, please?
Regarding, if I repeat your question, the question is regarding this the effect of immunosuppressants of on getting pregnant, and is it affecting the babies?
Mm-hmm.
See, if I recall our hand transplant patients, it's Manu. Manu, the first hand transplant patient, got married after his hand transplant. In
Mm-hmm.
fact, he married his own physiotherapy nurse. So that was a thing. So one and after the marriage, he has two children now.
Uh-huh.
Two children,
Mm-hmm.
and both of them are mm, excellent. I mean,
Mm-hmm.
there's no problem. He's doing extremely well. The children are doing well, and there's no
Mm-hmm.
problem. We have not had an instance of a girl getting hands and then getting pregnant. Nobody, it has not come to that level.
Mm-hmm.
But Manu was the one who got married. Let me think, is there anybody else got married and got children? No, no. It's only Manu.
Mhm. Okay, yeah, thank you. Professor, India is widely known for its modern technologies and innovations in the field of reconstructive surgery. Uh, I would like to ask you, do you use in your hand transplant program 3D printing for bone fixation? Or maybe do you use other modern technologies in your hand transplant program?
In hand trans, see, we have in our department, we have an inbuilt, we have an in-house model virtual surgical planning suite with the software and the computers and actually one engineer also, and
Mm-hmm.
we do lot of modeling of almost all our head and neck reconstruction, like jaw bones and all those things are
Mm-hmm.
definitely with the 3D printing and I mean our virtual surgical planning and modeling. It happens in hands. We have not found really the necessity of that in a
Mm-hmm.
way, because you can assess from the X-ray or CT scan or MRI scan the size of the bone, and then you cut it accordingly at that time, the plate fixation and all. But I would say that in face transplant, there is a great role for this, which
Uh-huh.
we are also licensed to do face transplant. We have not done one, but
Mm-hmm.
when we get a suitable patient, I'm sure this is going to be greatest sort of way you can plan exactly how do you cut the bone in the recipient, how do you cut the bone in the the donor and all those things, fixation, I'm sure it will be useful. But
Mm-hmm.
at present for hand, what have we innovated? What are the innovations which have used? I would say the more in fact, we are trying to develop, you know, the simultaneously hand transplant is not possible in all the patients, to be frank,
Mm-hmm.
right? And so single hand we don't do encourage too much because of the too much. I would say it's not that we don't do it. We
Mm-hmm.
don't we choose the patients very well diligently because of the nature, the immunosuppression needed and all those things. In those cases, we have been looking at especially in the upper arm level, the prosthetics are not working well because of you cannot put it there. So we are
Mm-hmm.
also into looking at the possibility of also integrating implants into that, and then putting a artificial sort of elbow joint, and then the bionic hand. So that is something which we are also working on, that which if you are since you are talking about innovations
Mm-hmm.
otherwise. And then we have several Indian companies who are also interested in you know printing the hand, as well as
Mm-hmm.
doing the robotic bionics or type of architecture to that printed hand. So these are all possibilities which, and the younger people, younger generation, and the scientists and the other institutions like we have several technical institutions which are very good, including our university. They are also keen to work with us for that.
Mm-hmm. Yeah, thank you. Professor, you have just mentioned it, face transplant. May I ask you about your future plans? Are you going to continue your hand transplant program or maybe extend it to other kinds of external organ transplantation?
See, now if you look at let us initially talk about the hand transplant, because I firmly believe that with our experience, we had to be, we have to be looking at it in a honest way. When you look at it, there have been problems. Like
Mm-hmm.
one patient had a chronic rejection because that patient failed to understand the importance of taking immunosuppressants
Mm-hmm.
regularly,
Mm-hmm.
stopped, and then we had to take the hands off after
Mm-hmm.
about 6 years, right?
Mm-hmm.
So, and then another patient without anything, we cannot call it antibody mediated or whatever is that. She had severe bone pains, and then we couldn't control in spite of all the things. And finally, she said that it was a form of rejection, whatever is that. So we had to
Mm-hmm.
remove it. So ups and downs are there in our program also.
Mm-hmm.
But if you let me take you the example of the same patient who lost, we had to remove his hands
Mm-hmm.
because of the his sort of not taking the immunosuppressor. Now,
Mm-hmm.
when we removed it, I asked him simple, what do you want, sir?
Mm-hmm.
He said, I want to have another hand,
Uh-huh.
right? Another hand. Then I told him, do you realize what is the issue? Then he said that if you give me another pair of hands, I am going to safeguard it as you cannot imagine the amount
Yeah.
of care I'm going to give. So
Mm-hmm.
this was a lesson for me, us also. Look, he has undergone a big transplant, then this big problem of rejection, having those mummified hands for a long time, he didn't want to get it removed. And then once you remove it, he wants the hands back again because he knows that he has to go through the whole process.
Mm-hmm.
So that is the way people look at it. People look at people who have lost their hands. Many people can sermonize anything, but if you put yourself in a plight where you don't have both their hands,
Mm-hmm.
it is, you ask Manu, our first hand transplant, he himself always says that he was on the verge of a suicide, right?
Mm-hmm. Yeah.
When, and
Understand.
you check our Shreya, she underwent all these things. She had a she was from a wealthy family, so she got the best bionic hands. Everything her mother was after her for supporting and training and all. But then she says that, look, I don't want, I want the hands. Once she got the hands, her journey was very tumultuous in a way. She had these rejections, then she had a PTLD, she had a CMA infection, so she has to undergo all the treatments. And then after that, if you ask her, what do you, then she went into, she joined a prestigious institution. She came out with the flying colors, graduated with a master's in business administration from one of the most prestigious places in
Mm-hmm.
the country, and she is
Mm-hmm.
placed in a good position now. So, if you ask her, is it worth all these things, then she will absolutely no doubt. None
Mm-hmm.
of these patients will ever say that the greatest gift they had was this hand transplant. If you
Mm-hmm.
think about the previous life without the hands and this one.
Yeah.
So
Yeah.
this is what has driven, given us more conviction that what we are doing is right thing. Let me be
Mm-hmm.
honest with you, Wesley. See,
Mm-hmm.
we most of the all the hand transplants might not work for long time.
Yeah.
Some people may have rejection, some people may have decrease in function. All those
Mm-hmm.
things are there. But if we can successfully do and get it working, the
Mm-hmm.
years they get with their hands is more worth than anything.
Mm-hmm.
Any number of years. Put that number of years, 10 years, 5 years, 10 years, 15 years, 20 years. So that each year is a big thing in their life. They are
Mm-hmm.
independent. They are independent. They can
Yeah.
live. They can earn. So
Yeah.
this is, and especially in Indian situation where your social security, social support is not brilliant. You have to depend upon, see, if you don't have hands, you have to depend upon somebody to
Yeah.
do everything for you. So
Mm-hmm.
there, the hand transplant matter a lot,
Mm-hmm.
matter. That is
Mm-hmm.
what is driving us, and that is driving other teams also, because
Yeah.
when we got successful, there are at least 10 teams in the country working on that. And
Mm-hmm.
that has made the country the biggest, biggest, and I mean the country with the largest sort of hand transplants, that is programs now, active programs in the
Mm-hmm.
world. So, which if you look at it, majority of these patients are paying out of pocket,
Mm-hmm.
but the cost is much less than what you can imagine in the West. Much
Mm-hmm.
less. See, our transplant cost will be around 20-25 lakhs rupees, will be what, I would say,
Mm-hmm.
uh, 10,000 will be to that. Maybe 100,000
Mm-hmm.
USD, that will be that.
Mm-hmm.
100,000. No, 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 no. Much less than
Mm-hmm.
that. So, even though it is out of pocket
Mm-hmm.
expense, which is given by different people, I mean, there are avenues of getting that money for them.
Mm-hmm.
Even then, I would say that it is one of the things that is quite useful for the country, for people who have lost both their hands. And
Mm-hmm.
that has been driving us to continue with the work like this.
Mm-hmm. Yeah, you are completely right. Yeah, you and your colleagues have a strong motivation from your patients to continue the hand transplant program, and yeah, yeah, really good, so to say, motivation for doing it
Yeah.
in the future. Professor Iyer, you have already mentioned this topic. How available is the hand transplant surgery and post-transplant care in your country? Does it have any government support or?
The government support.
Mm-hmm.
See, hand transplants are done both in private sector and government sector in the country.
Mm-hmm.
In the government sector, the patients need not pay anything other than sorry, I, did I get wrong? We are on now. Yeah.
Mm-hmm.
In the government sector, the patients need to pay only the material costs and all those things. So it's very much less. Whereas in
Mm-hmm.
the private centers, they have to pay the surgical fees and all those things, which comes to around maybe I say let me see, 100 USD is 70. I'll just need to calculate the amount.
Mm-hmm.
See, it is around 20 lakhs, 20 to 25 lakhs for the surgical thing initially. And they have to pay about, initially, about, uh, yeah, about thousand to 1,500 USD for the first year
Mm-hmm.
for the immunosuppressants,
Yeah.
and then every month about $100 for the immunosuppressants later on. But
Mm-hmm.
now you asked about the government support.
Mm-hmm.
May Rather than the government support, even the private hospitals, the patients who, if you are working in a some sort of company or we have had several patients who were working in the electricity
Mm-hmm.
companies, the government owned companies,
Mm-hmm.
or in a industrial firm where they will foot the bill,
Mm-hmm.
at least help them.
Mm-hmm.
Then there are several instances where philanthropic organizations help these people when there is a call out for this one.
Mm-hmm.
Thirdly, some of those there some people are insured, and then the
Yeah.
insurance companies pay for that. It is not that hand transplant is not covered by insurance. It's not like that. It's covered. So if
Mm-hmm.
it is a eligible patients, you can get that also. So
Mm-hmm.
that will cover the surgical costs. And the government, not for hand alone. You're talking
Mm-hmm.
about kidney and liver, especially kidney transplants. That also need immunosuppressants. So
Mm-hmm.
we can get the immunosuppressants at very nominal cost
Mm-hmm.
through the government run pharmacy outlets, which
Mm-hmm.
also has reduced the cost of the immunosuppressants, cost to these patients. So that is one great support we find it now.
Mm-hmm. I understand. Professor Iyer, how many clinics in your country offer this kind of treatment? Could you give a short overview of the clinics involved in the hand transplant program in your country?
See, we have about 10 more units. See,
Mm-hmm.
once we started the program, many people were thinking about it, but they had that block of, roadblock, the thought block of whether we can do it or not. Once we proved that we can do it,
Mm-hmm.
majority of them, many of them came, and I know we had, they had come to us
Mm-hmm.
and talk to us and then spend some time with us, how to organize these things, which helped a lot. And then we published immediately within few months. We
Mm-hmm.
published in a four-part series of articles about how did we organize the program. Secondly, what were the technical issue? How did we do the technique of hand transplant? Then the immunosuppression and
Mm-hmm.
the rehabilitation. So everything was really written as a guidebook for. It was an
Mm-hmm.
article, journal article. It came in the Indian Journal of Plastic Surgery, which was on open access. So
Mm-hmm.
anybody who wanted to do a hand transplant, they had a ready reckoner there. Even though we didn't want that way. Other people should, if they want, they should have a better thing. That's why we embarked on that, and we
Mm-hmm.
also set up the Amrita protocol for hand transplant, which was freely available, and we are ready to mentor anybody
Mm-hmm.
going for first hand transplant or setting up anything. So with that, I think it helped a lot. Helped
Mm-hmm.
a lot. Most of the centers, out of the 10, maybe at least 8 of them had
Mm-hmm.
gone through some amount of mentorship from us in a way.
Mm-hmm. Mm-hmm.
And so we have a very robust program now.
Mm-hmm.
The second best unit, which I would say, is the global Nilesh Sadbhai from Mumbai.
Yeah.
He also
Yeah.
started afterwards, and then he
Mm-hmm.
has done a considerable number of hand transplants. Then KEM Hospital in Mumbai again, Dr. Vinita Puri. This is a government sector hospital, which I told
Mm-hmm.
you it is totally sort of free of cost type of thing.
Mm-hmm. Mm-hmm.
Then we in Chennai there are two centers. Stanley was the other one, three centers in fact. That was
Mm-hmm.
Chennai. It was the JIPMER is a central institute in Puducherry. They were
Mm-hmm.
the second unit to start hand transplant after
Mm-hmm.
us. After us, then Stanley is a center for hand. Stanley Hand Center is a very, very famous one. They have
Mm-hmm.
done transplant. They are on the verge of, I think the government wants them to start a center for hand transplant in that area. So which they
Mm-hmm.
are, I think, looking at it. Then global hospitals in Chennai. That is
Mm-hmm.
another leading center, I would say, because Dr. Selva Sitharaman has done about 4 or 5, I think, hands. So,
Mm-hmm.
and in Delhi, our sister concern, see, my team, my main other person who was with me was Dr. Mohit Sharma, we were working together for several years, about 20 years. Then he moved over when we started the another sort of concern in New Delhi, that is national capital region, which is Faridabad, where Amrita has a unit, and I am also associated with that. So there we have started the program. Again, very strong program. 5 patients we have already done, and then another two, one in Calcutta, one in Delhi. I think that's the number of centers that are active. But there are a lot of people who are interested. I one another in Gujarat. Gujarat also has done.
Mm-hmm.
So yeah,
Mm-hmm. Yeah, this is really a large hand transplant program in your
yeah,
country.
yeah, yeah,
Yeah.
yeah.
Professor Iyer, you are the president-elect of ICVCA. Of course, I would like to ask you what motivated you to accept this position, and could you also explain to our viewers, please, what are the key goals and objectives of ICVCA?
ISVCA has been a great organization to bring all the people together. Now we are
Mm-hmm.
talking. I just forgot about the other organs that are covered in the these ISVCA means it's a Society for the Composite Vascular Transplants,
Mm-hmm.
which is not hand alone. It takes care of other organs which are transplanted. Or one is face.
Mm-hmm.
Second one is we transfer a lot of in the intestinal transfer and all. We take the skin as a composite thing, skin
Yeah.
and abdominal wall transfer. Then penile transplants have been
Mm-hmm.
done. Uterine transplants have been done. They were
Mm-hmm.
partly with the ISVCA. Now they are sort of, uterus is slightly different in a
Yeah.
way. So it is part and not part of the ISVCA. Then the other ones would be the scalp. The whole scalp has been transplanted.
Mm-hmm.
So different organs, like there is a talk about rectum, anal sphincter and all those things to be
Mm-hmm.
transferred. So all these things are possible, and some
Mm-hmm.
of them has been done in isolation.
Mm-hmm.
So ISVCA is a platform which brings all the people together.
Mm-hmm.
We had, if I remember correctly, all the meetings have got good representation from different specialists from
Mm-hmm.
different countries. And then last meeting in Finland was fantastic meeting
Mm-hmm.
where the focus was more on innovations and then way forward in research and way forward in standardizing the whole thing across the world. So
Mm-hmm.
it's a great platform where people meet together, and then
Mm-hmm.
we conduct webinars to educate the doctors, and
Mm-hmm.
then we the next objective, we had a hand transplant registry which was there, but it was not functioning very well in the recent years. And then so the one of the aims of ISVCA at present is to get a robust registry of the hand transplants as well as the
Mm-hmm.
waist transplants which
Mm-hmm.
are happening across the world, because there are a lot of countries which don't come into picture because the people don't know about it, that it is being
Mm-hmm.
done. So that is where ISVC has a role to bring them in and then get their data together so that we can learn together and progress together. And the
Mm-hmm.
research part also, we would like to have more sort of collaborative research in this
Mm-hmm.
and training. So these are all
Mm-hmm.
motives of ISVCA, which has been from inception. We have slowly grown up now. The number is up. The countries and the centers are also more. So
Mm-hmm.
naturally, there's a growth which is associated with that, and we expect that in next decade or so, there'll be much more stronger society, and we'll be able to do more and more good work.
Mm-hmm. And the next meeting will take place in, do you know, show the place?
It is to happen in Taiwan.
Yeah. Mm-hmm.
Taiwan.
Great.
So Taiwan and Changung Hospital, they have done hand transplant,
Mm-hmm.
and one more center in Taiwan has done the transplants. So
Mm-hmm.
we wanted to move the meetings to different parts of the world, even
Mm-hmm.
though initially it was centered in US and Europe. And
Mm-hmm.
then India, we had a meeting in 2019. That was the
Mm-hmm.
first time it came to this part of the world. And
Mm-hmm.
then it went back to Helsinki, then USA, Helsinki. Now we wanted to have it move towards Asia, and then so Changung and the Taiwanese group are hosting it.
Mm-hmm. Yeah, excellent. Excellent. Professor, thank you so much for the open and education discussion.
Yeah,
I wish you and your patients strong health and strength in the hands.
yeah.
Uh, yeah, I looking forward to meeting you in Taiwan, and I wish you success in your colleagues in your hand transplant program and all your activities. And yeah, I thank you very much for your support. I wish you all the best. Have a nice evening.
Thank you very much, because you have been doing a tremendously great job for the community, our community also. When you know, most important thing in this is the awareness among the physicians
Mm-hmm.
and the surgeon, I mean the doctor community,
Mm-hmm.
as well as the public,
Yeah.
where because this is a great thing. I think I always describe this as one of the greatest team efforts that somebody can undertake is a hand transplant.
Yeah.
About 40 people, 40 to 50 people, 15 to 16 hours, getting the hand from somewhere and bringing it here, and then doing it in a very coordinated sort of phase like that. It's a great team effort. And then why do we do it? It's for the patients. And then
Mm-hmm.
why do see do you the amount of stress and strain on the team is only rewarded by the gratitude we get out of this out of the patients who have received the hands. And
Yeah.
this is something, this is a message which, you know, such a type of talk we talk will percolate down, and then the good things which has been done by the medical science and the surgical science will percolate down, as well as the other greatest thing is the organ movement of organ donation, like
Yeah.
hand transplant recipients like Manu, Shreya. are all, I mean, icons for the organ donation movement. When they go, they talk in the public about the organ donation. Look, we are living with these hands
Yeah.
are the living examples of the greatness of organ donation. It strikes chord with the public. So I'm sure it's such a sort of platform, what you are all doing is helping the whole organ donation movement. Forget about hand transplant. It is helping a lot of other organs also that way, because you are the visible transplant recipients. Heart
Yes.
and lung and all those things, people live, but the hand transplant people, they show to the world that, see, organ transplant can be done and is useful. So that carries much more a greater emotional message than anything else. So I'm sure, thank you very much for taking the initiative to propagate this one. Thank
Yeah.
you.
Many thanks. Many thanks. Yeah. Professor, have a nice evening and goodbye.
Thank you. Bye.
See you. Yeah. Take
Bye.
care.
Bye. Thank you.